During the MHA intensive weekends, one of the activities that we have started doing and has really been quite successful are group activities where we have the students engaged in sort of an exercise. And so they're engaged in teams across cohorts on the Friday, and then on the Saturday morning, usually they present the results of the exercise. So we invited a vendor to come in, and the students undertook a product analysis. This vendor that we've just recently established a friendship with, Southwest Communications, based out of Louisville. Two folks came in, Chris Howard and Ivan Cagle, and they actually presented a product that they sell. It's a nurse call system. And the students had to evaluate the nurse call system, essentially a piece of technology. And this piece of technology was set in a hospital, and their hospital was sort of based in their group. And the hospital had different parameters, it was in a different situation. And they had to determine as a team whether this nurse call system would be of value to the organization. An RFP had already gone out. And so they had to look at it from a cost, a quality perspective, and then, of course, a nurse productivity perspective. They were given some parameters to work with, but they had to make a decision, which they had to present that decision the next day. It was really a wonderful exercise. Both Chris and Ivan presented their product for about 45 minutes, just like a vendor would do. And then the students had a few hours to ask questions, to work in their teams, and to essentially sift through this product, looking at the realities of their hospital and the need for a nurse call system. The next day, on the Saturday, they presented their results. As a whole, there was a lot of discussion back and forth, not just on the product, but also the process. This type of activity, again, sort of done in between cohorts, is something that could be touched on within a class, but what we try and do with the group activities during intensive is sort of broaden everyone's experience. This type of activity is certainly a real-life activity, technology product acquisition that happens on a regular basis. It's very complicated, usually never goes according to schedule, and there's a variety of issues that come during and after even a product is recommended. And so the students certainly, I think, had a good experience with this, and it's just really the type of activity that we like to encompass within the MHA program. It builds up a different set of competencies that perhaps are not directly covered in the courses, but certainly we feel is beneficial for the students' learning and for future healthcare leaders.